Eating disorders. Eating disorders are serious mental health conditions. Someone with an eating disorder will have eating behaviors like eating too much or too little regularly. They'll also spend a lot of time thinking about food and their weight or body shape. Eating disorders can have a significant impact on health, well-being, and relationships. They can also have an impact on your day-to-day activities. Types of eating disorders. There are different types of eating and feeding disorders, including anorexia nervosa, AN, avoidant restrictive food intake disorder, ARFID, binge eating disorder, BED, bulimia nervosa, BN. Other specific feeding and eating disorders, OSFED. BEAT estimate that around 1.25 million people in the UK have an eating disorder. Eating disorders can affect people of all ages, genders, cultures, ethnicities, and backgrounds. With treatment, most people can experience an improved quality of life. Eating disorders often first present in childhood or adolescence. They can impact on the young person as well as their family members or carers. Symptoms of an eating disorder. Symptoms of an eating disorder include spending a lot of time worrying about your weight, body shape, and food. Avoiding socializing if it involves food. Eating very little or a large quantity of food. Feeling that your eating is out of control. Making yourself sick or taking laxatives after you eat. Exercising too much. Having very strict habits or routines around food. Changes in your mood like being withdrawn, anxious or depressed. Difficulty concentrating on day-to-day activities like work or study. Your relationships with those closest to you can also be affected. You might also experience physical symptoms like feeling dizzy, tired or cold. Pains, tingling or numbness in your arms and legs because of poor circulation. Feeling your heart racing, fainting or feeling faint. Bloating, constipation or diarrhea due to problems with your digestion. Your weight being low or high for someone your age and height. Not getting your period or delayed signs of puberty. Warning signs of an eating disorder in someone else. It can be difficult to identify that a loved one has an eating disorder. There are warning signs you can look out for like weight loss or weight gain over a few months. Lack of awareness or belief that they are developing unusual eating behaviors. Eating a lot of food very fast or food going missing. Going to the bathroom a lot after eating. Talking critically about their body. Overexercising. Avoiding mealtimes with others. Cutting food into small pieces or eating very slowly. Wearing loose or baggy clothes. Related conditions. Someone with an eating disorder may also have anxiety, autism spectrum disorder, ASD, attention deficit and hyperactivity disorder, ADHD, complex trauma, personality disorders, depression, obsessive-compulsive disorder, OCD, mental health conditions during pregnancy and after the birth, post-traumatic stress disorder, PTSD, psychotic conditions including schizophrenia and bipolar disorder, substance misuse, alcohol misuse, type 1 diabetes, other physical illnesses, particularly those where symptoms and signs affect body weight or where treatment might affect body weight, such as cystic fibrosis, underactive thyroid, overactive thyroid, or inflammatory bowel disease. Peace Pathway has information and resources for autistic people with an eating disorder. If you have any other health conditions, it's important to discuss this with your healthcare professional so they can assess how this could impact your treatment. Other conditions that affect food and eating. Some conditions involve food and eating, but aren't related to concerns about weight or body shape. These include avoidant restrictive food intake disorder, ARFID. ARFID causes a person to avoid certain foods or types of food, restrict how much they eat, or both. Causes of eating disorders. Eating disorders are often blamed on the social pressure to be thin, but the causes are usually more complex. There are lots of possible reasons why a person might develop an eating disorder. The causes are different for everybody. These causes can be psychological, environmental, and biological. Treatment for eating disorders. An eating disorder can have a major impact on your life. It can affect your relationships, job, schoolwork, and physical health. With all eating disorders, the first step is recognizing that there's a problem and being willing to seek help. If you're worried that you have an eating disorder, see a GP as soon as you can. It can be very hard to admit that you have a problem and ask for help. Many people feel scared about asking for help, but it's important to get this help as soon as possible. It might help to bring a friend or loved one with you to your appointment. Getting help for someone else with an eating disorder. Your loved one might not know they have an eating disorder. They might deny it or avoid talking about their eating or their weight because it's such a painful, stressful subject for them. Let them know you're worried about them and encourage them to see a GP. You could even offer to go with them. There's a lot of information and advice available for parents and carers, including Beat. What to do if you're worried about a friend or family member. Beat. What to do if you're worried about a colleague. Supported. I care for someone with an eating disorder. Feast. Info for parents. Types of treatment for eating disorders. Treating an eating disorder usually involves monitoring physical health and supporting mental health. The type of treatment used depends on the person involved, what type of eating disorder they have. For some people, self-help or guided self-help can be effective. When guided self-help isn't appropriate, or wouldn't be effective enough on its own, a common treatment is psychological therapy. This may be working individually, in a group or as a family. Specialist dietitians may also be part of your treatment. Your physical health may also be monitored to support your recovery. For some people, it can be helpful to prescribe medication in combination with psychological treatment. Medication alone isn't usually effective for eating disorders. Further support. Find information and services that can offer advice and support about eating disorders.